Let them, have a chance of venting what other problems they may have, what kind of symptoms that they may have had in the, preceding year. I think it's a shame.
I just want to tap back to Dr. Singh. She said patients are feeling sorry for us for what we accept for the 1 hour, half an hour, whatever we spend with them. We don't see this, the picture behind this. We are on 24 hours a day, on call, 7 days a week, and all of that is counted in that $24 or $30 or $50 that you get. So I just want to make sure that people are aware of that. Nobody pays us for those parts of the time we spend being, hooked onto our cell phones and, taking calls and answering calls and so forth.
I think that's a very important point.
The second point is about the government option. Government option, there's several, but I want to talk about the Medicaid option. I can tell you very, very few doctors accept Medicaid. And I'm one of the very few doctors in Silver Spring that do accept Medicaid. And I get diabetics, I get, renal patients, all kinds of really significantly unhealthy patients. And in order to find an ophthalmologist for a diabetic, in order to find a podiatrist, a dentist, it is just impossible. Mm-hmm. It is impossible. You can call everywhere, nobody will accept it.
Some of the changes that are being proposed might address this, and I think obviously we will see the final shape of the bill. One quick comment that I have: every interest group has been at the table. This debate has been going on since the Obama administration came in, and somehow the physicians have really, I just, talking to you before now, the tort reform, caps on medical liability is a huge issue. It never made it into the bill. How come the physicians, which is such a articulate, intelligent, successful community, the AMA represents 800,000, and obviously API has done good work on the Hill, but how come they don't have a seat at the table and the AMA has a position initially supporting, then not supporting, and supporting and not supporting? Do you think the physicians somehow also kind of either are responsible or need to kind of get more active in getting their message out?
I think the physicians are split as well between primary care specialists, and the AMA unfortunately represents only 17 or 18% of the physicians, as they say on Fox all the time. So the issue is the physicians are not united, the younger and the older, the specialists and the primary care, and so on. So it will be impossible to have one voice as it is for attorneys or for business people and so on and so forth.
I think in addition to what you just said, I think it's a lot of physicians are burned out. They have long hours. They don't necessarily have the aptitude with, as much as the lawmakers, or the time that it takes to get involved in different things. They are just busy running their day, and most physicians are in the office. Most primary care doctors that I know are in the office for 10 to 12 hours a day. Where is the time to get involved, and be active and get your voices heard?
But in a participatory democracy, you have to get involved, just like Sanjay is saying with the US Impact and API. So if you don't get involved, you don't have a voice.
Okay, as we wrap up, it's really an opportunity for you, all of you, and I'll start with you, Dr. Mutta, if Senator Harry Reid or Senator Max Baucus or President Obama were listening, what would be the 1 or 2 recommendations that you would have for this health reform bill?
I'm totally in agreement with the government-run plan. The government can do it very well, and patients, if all of them are insured, it'll definitely cut down the government costs on healthcare plans. And more focus should be on primary care and preventive health, which will also be in favor of cutting down healthcare costs. Also, the tort reform, it's very important to keep cap on those payments too.
I'm very excited that every American is going to have health insurance, and I'm also very excited that people will not be denied health insurance because of their existing medical conditions. But I do think that the way it's going to be paid for needs to be looked at in a fair way, and also there should be definite provisions for tort reforms and eliminating frivolous lawsuits.
I'm very positive about the public option, and especially the provision for preventative care and outcomes research. But obviously there has to be a way to fund all this. That's the big issue, is where is it going to come? Is it going to come from the tax dollars? You're going to be taxed as much as we are. In England, 70% of your income goes in tax, or Canada or Switzerland.
I would like to see cutting the red tape more, especially in long-term care and in skilled care facilities. Long-term care by itself is the second most regulated, and the amount of red tape is ridiculous. Secondly, we need a look at the tort reform. Nothing can be accomplished, no matter who is out there coming up with some reform, if tort reform is not in the part of the package.
Thank you, everybody, for coming. I personally have learned a lot, and I think one important takeaway I have from all of this is that all of you, at least to a large extent, are for the public option and are very positive about insuring everybody. Obviously, all of you want tort reform in there in some shape or form. I hope all of you found this discussion as engaging as I did. And if you have any comments, suggestions, criticism, please send it over to darshan@darshantv.com. Thank you.